80-year-old A visited the hospital due to anemia. An endoscopy revealed that she had terminal stomach cancer. Her attending physician, Dr. B, informed A's daughter of the diagnosis. A's daughter was worried that if her mother found out the truth, she would refuse treatment. She asked the doctor to simply tell her mother that it was an early stage of cancer, and that treatment was necessary without revealing the full truth. Should Dr. B tell her the accurate diagnosis and prognosis? Or should the doctor respect the daughter's request and give a false or incomplete information?
One of the basic principles of medical ethics is that patients should make their own medical decisions. Physicians must recognize and respect this patient autonomy. In order to do this, doctors must provide patients with the diagnosis, available treatment options, and prognosis precisely, so they can make informed decisions about their care. However, in Korea, when patients are diagnosed with severe or terminal illnesses, doctors often discuss the situation with family members instead of the patient, and the truth is frequently withheld from the patient. So, is this approach right? In the US and Western Europe, it's widely accepted that patients should decide for themselves. Doctors almost always disclose the truth to the patient, allowing them enough time to choose whether to pursue active treatment or to focus on end-of-life planning, such as writing a will or spending their remaining time meaningfully. But in countries like Korea, where Confucian cultural traditions are strong, it's common to avoid telling patients directly about incurable illnesses, and instead make decisions through family discussions. If the family does not want the patient to know the truth, doctors often follow their wishes. Why does family opinion often outweigh the patient's own opinion in Korea? This may be related to cultural values, where even personal matters involve the family. In addition, medical costs are often covered not by the patient, but by their children or family members, and legal complaints or lawsuits over dissatisfaction with medical care usually come from the family. Interestingly, when asked how they would want to be treated if they themselves were seriously ill, many family members say they would want to know the truth. This is an irony. Why do families want to hide the truth from patients? Many say they fear that the patient will lose hope, fall into despair, or refuse all treatment. Others claim the patient wouldn't want to know anyway. As a result, many patients in Korea only find out the truth when their condition is beyond recovery, losing the chance to make decisions or prepare for the end of life. This often leads to unnecessary treatments and significant physical and emotional suffering. But in a society with such strong family-centered values, it's not easy for doctors to completely ignore family wishes and tell the patient everything. Moreover, it can be difficult to know whether the patient actually wants to know the truth or make their own decisions. What about cases where the patient is unconscious, has dementia, or otherwise cannot express their wishes? Usually, the family makes the decision based on the assumption that they understand the patient's personality, values, beliefs, and would support the patient's interests. However, this assumption isn't always accurate. If there are conflicts within the family, inheritance issues, or financial burdens due to treatment costs, the family's decision might not reflect the patient's true wishes. How do other countries handle this issue? In Scotland, if there is disagreement between the family and doctors regarding treatment, the case can be brought to court to appoint a guardian to make decisions. In the UK, family members have limited authority mainly in cases involving mental illness. In most situations, decisions are made based on the patient's best interests, not the family's preferences. Should doctors disclose the truth about a patient's illness even without the family's consent? Share your thoughts and opinions in the comments.